Hello everyone. Today we will talk about antimicrobials and antibiotics. So what are antimicrobial drugs? Anti means against, microbials means microorganisms, that is microbes. So the drugs which are effective against microorganisms or microbes are called antimicrobial drugs. An antimicrobial, it may control the microorganisms by killing them or by inhibiting the growth of those organisms. So they are of two types, bactericidal and bacteriostatic. The first antimicrobial drug was synthesized by German bacteriologist Paul Ehrlich in 1908. And he named that drug as arsphenamine, also known as salvarsan. Salvarsan can destroy the bacteria spirochete. Spirochete is responsible for syphilis, which is a common skin disease. At that time, he was also working with the azotides, and he found that salvarsan has got arsenic double bond arsenic linkage. Now in this context it resembles with the azotides because azotides they have N double bond N linkage. So since he was working with the azotides also, so he synthesized prontosil, which is an effective antibacterial agent, and it resembles with the salvarsan. So further antibiotics. Now antibiotics, these are the chemical substances which are secreted by the microorganisms and they are effective against other type of microorganisms. Now this is an old definition because nowadays we have got many synthetic antibiotics. So antibiotics are the drugs or simply the medicines which can be purely or partially synthesized in the lab and they are effective against other type of microorganisms in their low concentrations. Now antibiotic, the very first antibiotic was prepared by Fleming, and Fleming he synthesized penicillin. Now penicillin, there are varieties of penicillin available nowadays. Penicillin is effective against pneumonia, bronchitis and sore throat. Penicillin can be penicillin G, it can be penicillin F, penicillin K, and there are synthetic modifications also available in the market. Ampicillin and amoxicillin are synthetic modifications of penicillin. But the problem with penicillin is some patients are really sensitive to it. So before its administration, sensitivity test is must. After this, so what is a spectrum? Now the complete range of microorganisms that can be killed by a particular antibiotic is known as spectrum. Antibiotics can be classified into three types: broad spectrum antibiotics, narrow spectrum antibiotics and line or limited spectrum antibiotics. First of all, what is broad spectrum antibiotics? Simply these are the antibiotics which are effective against large type of, means against different large number of the bacteria, different types of bacteria. They are called the broad spectrum antibiotics. For example, chloroamphenicol, tetracycline. These are broad spectrum antibiotics since they are effective against variety of microorganisms. After this, narrow spectrum antibiotics. Narrow means they are effective against few type of organisms, few type of bacteria. So that's why the term is narrow spectrum antibiotics. Narrow spectrum antibiotics are either effective against gram-positive bacteria or against gram-negative bacteria. However, broad spectrum is effective against both type of the bacteria, gram-positive as well as gram-negative bacteria. So examples of narrow spectrum are streptomycin, chloromycetin. Coming to the third type, line spectrum antibiotics. So line spectrum antibiotics means they are effective against a particular bacteria only. For example, diacid-diazonin. It's a line spectrum antibiotic and it is effective against certain strains of cancer. After this, coming to now streptomycin. So streptomycin is very effective antibiotic and it is used in the treatment of tuberculosis. Now antibiotics, they can work by two ways. They can either kill the microorganisms or they can just stop their growth. So on the basis of this, they can be bactericidal as well as bacteriostatic. Bactericidal examples are penicillin, aminoglycosides of floxin, and bacteriostatic are erythromycin, tetracycline, and chloroamphenicol. So chloroamphenicol is basically a broad spectrum antibiotic and it was isolated in 1947. It can be given to the patients orally because it is rapidly absorbed from the gastrointestinal tract. Very effective against whooping cough, typhoid, dysentery and certain primary infections as well as meningitis. After this, coming to now the ampicillin. Ampicillin, I told it is the synthetic modification of the penicillin. And ampicillin works against large number of diseases but of course it induces allergy also. So allergy test is must.